Tissue harmonic imaging is another tool at our disposal. Tissue harmonic imaging gives us a reduction in image artifacts, increases the contrast resolution of the image, and provides better visualization of tissue interfaces, especially on our technically difficult patients. Let's look at that liver mass again, both with fundamental imaging, which is an image without harmonics, and using tissue harmonic imaging. Notice that while we are able to see the mass adequately on this patient, the difference in contrast resolution is striking. Also notice that the image with the harmonics that has much more well-defined borders. Another technique we have is spatial compounding. Depending on the manufacturer, this will have a variety of names. Using spatial compounding, instead of sending all the scan lines in one direction, we send the scan lines in multiple directions. This helps eliminate edge shadowing artifact and reduces speckle. Remember that spatial compounding will decrease the frame rate of your image. Let's look at these two images of the transverse carotid and notice that this image without spatial compounding, we are able to see a significant amount of speckle within this image. Notice with spatial compounding, we've drastically reduced the speckle, and in fact, we have better definition of some of the soft tissue structures in the neck. Let's look at some case studies. Let's look at some case studies, and you decide what is wrong with this image. Evaluate this image. Tell me, what do you think is wrong with it? Correct. The image is underpenetrated. We're not seeing this far field well at all. So how would we correct it? I would increase the TGC in the far field. I would not adjust the overall gain because I notice that these echoes are adequate. However, it's the far field that's too dark. If increasing the TGC in the far field does not give us a good image, then we might want to decrease the frequency instead. Let's look at this image and see what we think. I agree. There are echoes in the inferior vena cava, and there shouldn't be echoes in a normal blood vessel. When looking at a still image such as this, we're not able to tell if those echoes represent pathology, such as clot, or that our gain is too high. In this image, I don't know where my focal zone is, so one of the first things I would check when evaluating this image is where is the focal zone. Also, you may want to decrease the far field TGC to get the echoes out of the IVC. Now, of course, make sure that those echoes aren't pathology, so you might want to put color Doppler or some other technique to make sure that they're not real echoes in that IVC. Let's look at this image. What do we think? There are echoes in the aorta. Also, this image is fairly noisy. Let's look at this hepatic vein and you see echoes in there. We should not have echoes in normal blood vessels. Putting on tissue harmonic imaging will give us better contrast resolution and eliminate those artifactual echoes. Notice also that we have much better definition of the hepatic vein. Evaluate this image and tell me what you think. Notice that the image is labeled sagittal aorta, so we're being led to believe that it is the aorta we want to evaluate. Correct. The focal zone is here. Notice that different manufacturers may use different symbols for the focal zone. But with the focal zone placed up at the region of the left lobe of the liver, we do not have adequate visualization of the aorta. Lower your focal zone to at or below the area of interest. Notice in this image, with the focal zone properly placed, I have much better definition of the far field. What do you think of this image? I agree, it's way too dark. For this image, where all of the echoes are uniformly too dark, I would increase the overall gain. This image, what do you think? In this image, there's either a mass here, which I don't believe, or my near field echoes are too high. Notice that having improper TGC settings or improper gain settings can actually make something look pathologic. We need to adjust our TGC in the near field to make all these echoes uniform. What do you think of this one? Correct. In this case, the far field gain is too high, and therefore I again would adjust my TGC. When you hit the freeze button on your image, stop and evaluate. Look at the image as a whole and ask yourself, what do I think about this image? So for example, if I hit freeze and I saw this, I might not have noticed while I was scanning that the far field was too bright, but by hitting freeze and evaluating each and every image, and it only takes less than a second, I can be sure that every image I take is my best one. Now let's look at this structure. What do we think of this structure? Correct. It's not very clear. The borders are fairly ill-defined. Well, this image was zoomed using a read zoom on the machine. However, if we use right zoom, notice I have much better definition because we're able to redraw the image, preserve the pixel density, and maintain spatial resolution. What do we think of this image? I agree. The depth is not properly set. I don't see the diaphragm in this image. So therefore, I am cutting off part of this image and I may be missing pathology. Therefore, we need to adjust the image depth. Remember that a lot of our pathology, especially in the liver, occurs on the edges of the liver, and I've seen masses missed because the depth was not properly set. What do we think of this one? I think the focal zone's in the perfect spot. I think the echoes are uniform and adequate, and I can see the diaphragm. So I'm done, right? Wrong. The depth in this image is not properly set because I have too much wasted space. If you want to optimize your image, you need to have the largest image that you can have on the screen without cutting off anything. For one thing, it makes the image easier to read and it's easier on the eyes, and it's the optimal way to do it. So again, for this image, properly adjust your image depth. Now let's look at this structure. I think there's a few issues with this image. Yeah, I agree. This image is way too dark. We can barely see any definition in this liver whatsoever. And also, remember what I said about measuring something. If you're going to measure a small structure, such as this 2.5 millimeter bile duct, you really want to zoom up on it before measuring. So on this image, I would adjust my gain. I would take my overall picture just to show the reading or interpreting physician that this is a structure I'm going to be measuring next. And then the image that I take will be zoomed, and I will take the zoomed image both with and without calipers. See how much easier it is to see exactly what I'm measuring? And let's look at this image, and what do we think of this? Now, before you say it's a bad transducer, or maybe somebody ran over the cable of this transducer, notice that this dropout, these echoes, don't occur at the very surface of the image. The problem with this image is that you don't have enough gel. Especially when scanning the groin region, it's very easy to get air underneath the transducer because of the anatomy in that region. So for this study, I would add more gel. Adding gel will eliminate the air that is trapped in between the transducer and the patient's skin. However, let's look more closely at this transducer. Notice that in the very corner, I do have an area of dropout. When I add more gel, if this is caused by air, this will disappear, but this won't. And let's take a look. Right, once I added more gel, I had better visualization because I don't have any air in there, but notice that this area of dropout persists throughout the study. That's because this transducer is damaged. So remember, you are the artist and the patient is your canvas. Be sure to properly take every image as optimally as possible. Evaluate your images and be sure that you're using the best image you can to demonstrate anatomy, both normal and abnormal, and you'll take the best pictures that you are able. Thank you very much.